Welcome back to Zen Beauty. I'm excited to bring to you today Dr. Amir Karam, who is a facial plastic surgeon who specializes in fat transfer. He's going to be demonstrating to us the use of fat transfer into the face to enhance those cheeks. Our medical expert is Dr. Joseph Bivens from Fort Lauderdale, Florida. He'll be with us to ask questions for Dr. Karam.
Great, thank you. It's very exciting to be here. One of the main things in my practice that I do is facial rejuvenation, and a lot of patients come in looking for facelifts and eyelid surgery. And one of the things that I've realized over the years is that one of the components that we miss oftentimes when we're performing these surgical procedures is the face ends up looking a little two-dimensional, a little pulled, a little, some patients come in, they're worried about that windswept look. One of the things that, as you look back at those patients and also study what faces look like when they're in their 20s and 30s, you realize that one of the components that needs to be addressed is facial volume. Volume in the face is one of the three critical components of aging. The first would be, the skin. As one ages over time, the skin undergoes pigmentary changes, also begins to form wrinkles. The volume underneath the skin begins to deflate. The fat in the face begins to diminish over time and gives that face a little bit more of that deflated look. The third component would be the sagging of tissues. That's what most patients think about when they come in for surgical procedures is, a facelift or eyelid surgery to improve the sagging quality. But without improving technically all three of those components, you don't get the most out of the facial rejuvenation procedure, and you often don't get the face looking as natural as possible.
Well, Dr. Karam, let me ask you a question. When patients come in, what is the first thing that they're asking you to address?
Usually the first thing that they want is, they put it in general terms. They want to look young or younger or just look great for their age. The second thing that they always mention is they don't want to look unnatural. They don't want to have that operated unnatural look, and that's what we spend most of the consultation discussing, is how to avoid looking unnatural and having that obvious surgical look that goes around.
What's the average age of the person that you're working with? What is the average age that they come in?
The typical patient that comes in for these type of procedures is someone in their late 40s through early 60s. I would say that encompasses the bulk of the patients who are interested in these type of procedures.
Specifically, what areas of the face would you start to see, let's say, aging in the 30s,
sure,
and then 40s, and then let's move it up into the 50s.
And Amy is a great example of somebody who has very nice volume in her face overall. But looking at the face from top to bottom, we always look at the position of the eyebrows. And another very important area is this fullness you see in the region of the upper brow, or right underneath the brow. And this fullness often gets deflated pretty early in age, and I'll show you some photographs of how that manifests. And then around the eyes, there's a fat pad that exists right underneath that covers the bony rim here, and that begins to lose its volume. So we begin to see the outline of the bony rim, and that gives the face a little bit more of a drawn, tired look. So I would say the changes that are occurring in this region are one of the earlier changes that you start to see. And then as one ages, you begin to see a little bit of a demarcation of the upper cheek with these folds here looking like they're coming down. And this fat pad that exists right here, it's termed the malar fat pad, begins to become deflated and lose its presence. And you get that, in the younger patients, you have this nice full cheek, and you begin to lose that. Another important area as time goes on is the depressions going along here, along the jawline, which gives the appearance that the jowls are a little bit more prominent than they actually would be.
Now, do you find that there are changes in the lips as well?
Absolutely. That's a great question. The lips, with time, do become a little bit deflated, and often patients are requesting to have their lips have that youthful fullness that they once had. And
now, one thing that I've recognized is that many plastic surgeons look at the face and they define aesthetic units. Mm-hmm. When you are starting to augment the face, can you specifically identify aesthetic units of the face that you would approach?
Absolutely.
And what is your approach to those units?
My particular approach to the units may be a little different than others, but the way I think about the face, the upper third of the face, I define it as a plane that goes through the corner of the eye and everything above it, so the brow, the forehead, and the upper eyelids. That would be the upper third of the face. The lower third of the face, I think of it as everything below, from the lower eyelid down to basically right around the plane of the mouth here. That would be the middle third. So this whole area would be is undergoing changes together, and then the lower third would be a line that goes through the mouth down to the neck, and that's the lower half of the face that needs to be looked at. And that's a great question, because the type of treatments that one utilizes is going to depend on the changes that are occurring in each part of this face. For me, the upper two-thirds of the face is mostly non-surgical, with the exception of the upper eyelids. And the lower half of the face is usually where the facelift or the neck lift comes into play to improve the contour of those areas.
Now, Amy makes a wonderful after photo, but I think we should start to look at some before and afters.
Absolutely.
And as I understand, you brought some things for us to take a look at.
Absolutely.
So maybe we can see some of your beautiful work.
Okay, so this patient, she's in her, I believe, early 60s. I think she just turned 60 at the time we did this procedure.
Can you define for us some of the things that clearly define what makes an aging face in a 60-year-old person?
Yeah, absolutely. And these are just some before and afters that are they're going in and out here. But you can see there's a deflated look in this region here, and there's the presence of jawline. You lose some of that jawline in the patients. You get these jowl formations, some lines around this area. And this is a patient that underwent fat transfer to this entire region to create a little bit of softer look around the eyes, and also a little bit more prominence of the cheekbones. Also, a little bit of fat was placed in here to create a little bit more of a smooth jawline, and a mini facelift was performed to improve the contour of the lower third of the face.
Now, what do you mean by a mini facelift? Because there are numerous types of facelifts. There's a mid facelift. There's an extended. How do you define a mini facelift?
That's another great question, because there's a lot of confusion out there on the different types of procedures. But basically, the mini facelift would be something that would be short of a full face and neck lift in my practice. It means a smaller incision on this corner of the near the ears, but it would not address the neck directly.
Now, are you incorporating fat transfers with facelifting, or are you doing it as an isolated procedure?
No, there's very few patients that I do a facelift on or a mini facelift on that I don't incorporate some degree of fat transfer at the same time. And it usually involves transfer of fat or volumetric sort of building of the upper third of the face, and then the surgical component, the facelift component, addresses the lower third. So almost all the patients will get this. Now, this is a patient who will see the video, and she was done actually last week. We don't have her afters here, but as you can see here, she's very deflated in the upper cheek region. She's got this kind of a deep sulcus along her orbital rim, which we were pointing out, and also she's got this extra skin along her eyelids. So this is a patient that we didn't do a facelift on at the same time, but we just did fat transfer to this segment. Followed down the road, she'll probably come back for some work along the jawline.
How does fat grafting improve that appearance? It appears as though a patient of this nature would come into the office and say, "Doctor, please get rid of these bags under my eyes." Are you removing the bags, or are you simply enhancing around the bags?
And it all depends. I think if we go to the next shot, I'll show. That's a really good question. These type of patients, depending on the anatomy of that fat pad, it's a little bit more complicated than I originally had thought. This type of patient here has, as you can look at the position of the eye, the plane of the eye, and where the bony rim or the cheek begins. These type of patients, if you remove fat from their eyes, they're actually going to end up looking more hollow. They'll have a bigger looking eye. It'll actually be kind of counterproductive in what we're trying to do. So in these type of patients, the proper treatment for this type of anatomy is augmentation, and in this kind of a scenario, it would be pure fat transfer without. Now, on the other hand, if it was somebody who had a really large amount of extra eyelid fat, and they also had some changes that were consistent with the loss of volume. In those cases, we would take out a conservative amount of fat through a technique that we go through the eyelid, but we would also add fat in those patients. So it's kind of a scenario that goes, they always complement each other, just depending on the anatomy.
Now, when you